Imagine seeing a 15-year-old boy who's playing football on the field, and going after that play. He's gonna make that play, and he gets hit in the head, and before you know it, he doesn't remember who he is or why he's even playing football. Then imagine yourself again, an NFL player who is, these guys are built big and tough, and they've been playing for years, that gets hit in the head due to a collision, and these collisions sound like car wrecks, and is also unconscious. These are two different people, two different scenarios, who suffer from a brain trauma, or as we like to call it, concussions. In today's world, especially in the world of sports that feature hard hitting, it's very common to get a traumatic brain injury, which is better known as a concussion or TBI. Concussions are a huge part of injuries in sports and in life, as especially between the ages of 14 and 19, and according to the American Academy of Pediatrics, as concussions have risen over 200% among teenagers between the ages of 14 and 19 in the last decade. Everyone needs to understand what a concussion is, because it could affect you, and you might think about it and you're like, it's not going to affect me. It could affect your kids near in the future if they decide to play sports. I will inform you today of 3 types of concussions as well. My name is David Rivas, and I've had experience in my life regarding this issue, because I've had 2 concussions in my life. One was in 4th grade and one was in 8th grade, and they were both playing football. My second concussion was a severe concussion, as don't remember what happened from when I got it, a little bit before, and then when I got it, I didn't remember anything, and then after, it took like 2 or 3 hours, I woke up and I was in my room at my house. But today, I want to define what a concussion is, and then I want to explain the 3 major types of concussions. First, I will explain what a concussion is. A concussion is a temporary brain injury that occurs as a result of head trauma. Concussions occur when the head impact jars and shakes the brain inside the skull. As you can see here, this is a picture of the brain moving back and hits the back of your skull, and then it moves forward and hits the front of your skull. Concussions are characterized by the brief period of unresponsiveness or loss of consciousness, disturbance in vision and or balance, confusion, and short-term memory loss. Concussions may cause athletes in particular to rethink about playing the sport that they are in. Athletes rethink this because concussions have long-term effects on the health of the body, especially on the brain. According to Dr. James P. Kelly, director of the National Interped Center of Excellence for treating veterans with TBI, better known as traumatic brain injury, and is also a neurologist for the Chicago Bears. He stated that multiple concussions are a big concern because it can be compared to war-related head trauma, which usually involves a battlefield blast, and it's compared to impacts against the head, like football players, other concussions that are received as well. It's being compared to like that. Former NFL players across the league filed lawsuits against the NFL because they were experiencing side effects, including clinical depression. Some even were suicidal, got to the point of suicidal, and they were killing themselves. Now that I have explained what a concussion is, I will talk about the 3 main types of concussion. There are 3 types of concussions that I will be talking about. The first one is grade 1, which is a mild concussion, grade 2, which is a moderate concussion, and grade 3, which is a severe concussion. The first one is a grade 1 mild concussion, and those are typically from hits that are not as hard to the head. So that's just if you bang your head, it's not really a big hit, but you feel it. Symptoms that are felt with a grade 1 concussion are slurred speech, confusion, but the person doesn't lose consciousness and is okay after 15 to 20 minutes. There is no exact treatment for a grade 1 concussion, as the symptoms just tend to disappear. The best way to maybe cure it would be to just sit down for a moment and just relax and just let it go away. Examples of grade 1 concussions are, like I said before, getting hit in the head, and feeling dizziness afterwards. The second type of concussion is a grade 2 concussion. This is grade 2 concussion is a moderate concussion. This one does not result in a loss of consciousness, but symptoms last longer than 20 minutes. So you'll get a headache and it'll be throughout the day. It might take 24 hours for you to relieve from that headache or whatever is going on. People who sustain grade 2 concussions may not remember the injury when they got hit, but then they'll remember everything afterwards. It'll just kind of like, once they get hit, they kind of get blacked out. People who, then this is called post-traumatic stress or amnesia. These concussions happen when a hard blow to the head is taken, like for example, I'm playing football or something, I get tackled but my head hits the ground. I might, most likely it'll be a grade 2 concussion. These concussions are treated with some sort of pain reliever like ibuprofen or Tylenol or something like that, just so you can get rid of the headache, the dizziness, and stuff like that. The last concussion, the most severe concussion, is a grade 3 concussion, where the person loses complete consciousness, usually for a brief period of time, and often does not remember what occurred. With a grade 3 concussion, it makes you lose consciousness for up to a day in severe cases. People who suffer from a grade 3 concussion tend to repeat what they say, so they tend to go back and forth. They stare a lot, and when you're talking to them, having a basic conversation with them, they tend to just, slowly answer questions or stuff like that. Usually, in these type of cases, immediate medical treatment is necessary because it's just a little balance right there. Just go to the doctor, go to the medic's office and get it treated. Now that I have talked about the 3 types of concussions and treatments for them, this should give you a better understanding of concussions as a whole. In conclusion, I defined and I stated what a concussion is, and I gave a couple of examples, explained what the 3 types of concussions were and how you can take action. Now with the information I have provided for you, you are able to understand what a concussion is, and you can use the knowledge provided to maybe not only help yourself, but if your kids are to have a concussion in the future, you can help them as well.